Good morning. I hope everyone is doing well. My name is Rebecca Kiesling, and I hope everyone can hear me. Um, I am the Director of Programs at the Benjamin Rush Institute. For those of you not familiar with Benjamin Rush Institute, BRI, we are a national organization that has over 40 chapters, which are medical schools. Our hope and our goal is to reach out to medical students throughout the country and the world to educate them on free market healthcare alternatives, which during this pandemic is more important than ever. These free market healthcare alternatives can range from direct primary care to insurance alternatives. And now, as Dr. Houston's going to explain, it can range into digital. And that's what we're excited about today. We've been around almost 9 years, and we're growing exponentially. If you're interested in speaking, if you know medical students in areas that we're not, I'd love to speak with you. You have my email address from some of the posts that we've explained, that we've put out about this webinar today. We pretty seamlessly moved to online events because we have been streaming between our chapters for a couple of years now, our events. Our events can range from book clubs to debates to bringing people, experts in their field, to our students. We have a couple, I see some of our students on today, so hi guys. I'm excited that you guys have joined. It was an easy choice for us to open up our events to the broader public because our goal is education. We are a 501c3, and what we do is educate. So moving from just educating students to the broader public, we have such a unique opportunity right now to educate about different alternatives in free market healthcare. So I am excited today to have this chance we have interviewed on our wonderful podcast. And if you haven't had the opportunity to listen to our podcast, it's Next Generation Medicine, hosted by and I see him on here today, our wonderful medical student, Tony Mazzaffaro. Check it out. It's on iTunes. It is also on our website, which is benjaminrushinstitute.org. That is how I was introduced to Dr. Leah Houston. And I was enthralled by her story. She is the founder of HPEC, HPEC, and a board certified emergency physician. While practicing emergency medicine across the US for nearly 10 years, she recognized a common problem: uncompensated administrative burdens related to physician employment and credentialing, which are a leading cause of administrative waste and physician burnout. And as we spoke recently, physician burnout is something that's near and dear to my heart, and a main reason why I do what I do. I want students to understand that as they reach that point of burnout, which is so overwhelming, they have alternatives. We need to start that education early. So that's why I was personally so enamored by what she does. And it's so important, as she realized that distributed ledger technology could solve the obstructive regulatory problems in healthcare by creating a decentralized community of physicians. She began working on the project and named it HPEC, the Humanitarian Physicians Empowerment Community. HPEC is building a platform that will give every physician a self-sovereign digital identity attached to their credentials in order to create a democratic digital physicians guild. HPEC will streamline the current antiquated and laborious process of credentialing, reduce administrative waste, improve access to care, and give physicians sovereign ownership of their data and employment rights. This organization is also going to create an opportunity for physicians to communicate more efficiently about policy and practice in order to improve patient care. There's so much here. And if you think about where we are right now, doing this is going to allow us to move our physicians more efficiently. And if you think about what she's going to speak about in terms of where we are now, it's enormous for us. In presenting this solution that has potential to alleviate the administrative waste for health systems, government, and practicing physicians, she is recognized and requested as a national speaker on this topic of decentralized identity as it relates to healthcare. Her work was featured as part of the first HIMSS blockchain and healthcare textbook published in 2019. A lifelong advocate, innovator, and investor, she has also spent time lobbying for public policy and healthcare reform. She really understands the problems that plague the healthcare system from the inside and out, and has dedicated her time to repairing the current global healthcare crisis. HPEC will restore the physician autonomy to the practice of medicine, and this needs to begin in the US and expand outward. I am so excited to hear Dr. Houston today, and I'm going to turn it over to her.
Hi, everyone. Thank you. That was such a kind and generous introduction. I really appreciate the opportunity to share this with you. So I'm just going to get into it and share my screen. I hope everyone can see me here. And I'm going to play the slideshow. Okay. Is that good? Can you see me okay? I just wanted to make sure. I guess you can. I'd like to deuce this guy down here, but I guess it's going to be there. So as she said, we're working on a project that aims to allow physicians to own their own credentials, their identities, and their right to work digitally. And in this ever-advancing digital world, we kind of have to start thinking about that. So why am I here? Why did this happen? Yeah, I did experience a lot of friction, waste, and burnout, but what really happened is a hospital that I was working for when I was an employed emergency physician was using my professional identity to bill under my name after I left. And that whole experience really allowed me to think about the employment process, the credentialing process, and what happens to the physician community when things go wrong and when they have to kind of relinquish all of that control. And that's how I came up with the idea that this new technology could not only alleviate that, but could be used to fix a lot of the problems in our healthcare system. But when I was working as an emergency doctor, I felt that there was a lot of things wrong. I felt really like things weren't happening easy. I had very little control over what was going on, and I did my best. But the fact of the matter is that physicians are not in control of healthcare right now. And we are the ones that took a Hippocratic oath. And so really, we're the ones that need to be in charge and need to be the ones making decisions so that this chaos that they currently call our healthcare system, this was put out by the Department of Health and Human Services as a demonstration of our current healthcare system. And where are the doctor and the patient in this? All the way at the bottom. Why are they not at the center? That's a problem. You look at this chart put out by my friends at Citizen Health, which essentially demonstrates the increase in administrators and how it correlates to the increase in regulations. So we look at the HIPAA Act of 1996, the Affordable Care Act, high tech, and this little blue line at the bottom, that's the number of physicians that have increased with all of this administrative bloat that's increased. That's what's causing this friction. And that's what's causing the sense of disempowerment that's leading to what people call burnout, but really it's about physician abuse. So this is an example of a check from United Healthcare to one of my physician colleagues who is a double board certified Ivy League educated OBGYN, and she got paid 1 penny for her annual exam. This is another one from another one of my physician colleagues. This is a prior authorization required by a pharmacy benefit manager called Express Scripts. And pharmacy benefit managers are third-party administrators that essentially control the entire supply chain of medications into the health systems and onto formularies. And they're basically requiring physicians to, fill out all this paperwork just to be able to get their patients the medications that they need. These, in my opinion, this is an example of the corporate practice of medicine, and it's dangerous for patients. And we talk about danger, we're talking about human lives. We're talking about patient safety. So as United Healthcare is only paying us a penny, their stock prices are going up and their shareholders are benefiting from extracting value from the doctor-patient relationship. And so physicians are frustrated. They want to get out of medicine. They're starting websites. And if you look at this chart put out by the AAMC, we're going to have a physician shortage of 42 to 121,000 by 2030. So, this is really a big problem, and it's getting worse. And so the real people that suffer are the patients. These are patient Twitter tweets that they put out. They're afraid they're going to die. They're Googling their symptoms and hoping it's not serious. They're not able to find doctors because there's a wedge between the space where patients and doctors live. There's no way for patients to easily connect with their physicians and to find them easily. These third parties have stuck themselves between the doctor and patient. And that's what we're going to talk about, how we're going to get rid of it. And it's led to a decrease in life expectancy for 2 years in a row. And so this is not only sad and scary and frustrating, this is killing people. And so this is a map that I thought was really interesting because it demonstrates social media connections. I think this one in particular is Facebook. And I love it because, the internet was invented in 1991, and look how connected the world is now because of the internet. And I think that this is a real opportunity for people to come together, for communities to work together towards common goals. And this technology has a way to do that in a way that's never been done before. It has a way to allow communities to organize against entities that are not serving them. And this is called self-sovereign identity. And I don't know if you can see, I'm going to lower that. Perfect. So I'm just going to discuss the technology quickly. I don't know if you guys notice when you log in online, you can sometimes use your Google ID or your Facebook ID. That's called single sign-on technology. And so that's a currently available technology to allow you to essentially make it streamlined to log into the internet. But when you do that, Google, Facebook, or whatever other single sign-on technology you've used to log in is tracking you, is watching you, is collecting your data. And, they're then turning around and doing something called surveillance capitalism, where they're surveilling the population and they're capitalizing on our behaviors, on our thoughts, on our action. Now, this new technology, in a similar way, will allow you to log in under your own self-sovereign identity. And what that means is that you own and control all the data that identity creates. Somebody might not be muted. I hear a lot of background noise there. So when you log in with self-sovereign identity technology, there's no third party that is allowed access to that information. And so what does that mean? It means that you can keep all of your data in a data locker. So anything can be digitized. It can be your birth certificate. As a physician, it can be your medical degree, your residency certificate, your medical licenses. As a patient, it can be your electronic health records. These can all now be owned and controlled by you in this new digital wallet and this self-sovereign identity that allows you to log into the internet and not be controlled by these third parties. And so the point of this is that this self-sovereign identity means agency. It means agency and autonomy for the individual. And that's why I want to leverage this technology to give power back to the doctor and patient. So with this technology, as a patient, if you want to see a doctor, you will no longer have to go through a hospital or an insurance company first, asking for permission to connect with a physician. You could go online, book an appointment with the doctor directly through their self-sovereign identity, and then connect with the physician directly, transferring your electronic health information digitally with no third-party oversight, keeping that information private between you and your physician. And that's the way I think patients want it to be. And as a physician who took the Hippocratic Oath, that's how I want it to be too. And that's why I'm trying to build this technology for all of us. So what is this? This is a digital passport for the physician community. So my company is building the physician-facing side of this that will later allow patients who have their own self-sovereign identity to plug in to our system so that they can interact with doctors directly. Now, you don't know as medical students, but the credentialing process to be able to work in a hospital is pretty much just as onerous as the medical school application process. And it's extremely long, it's extremely expensive, and it takes 2 to 6 months to be able to credential for a new hospital. So this technology will allow that process to be digitized, owned by the individual doctor, and streamlined in a quick fashion that will allow physicians to move freely from health system to health system if they choose to be employed, which is very valuable once you start practicing. And it accurately allows you for the identity verification. But in my opinion, the most important piece is the communication and data transfer piece, where you can keep your information between you and your patient private. And so we are the first company that aims to do this in a completely self-sovereign way for the physician community, by the physician community. And, you know, although there are some identity and credentialing tools out there, ours is the only one that aims to also have the communications component, which I think physicians really would value. And so this is a brand new technology. And so it's very nascent. So the time is now. Physicians and patients are frustrated with the current system. So this has creates an opportunity for us to build a new system. And from a regulatory standpoint, if you look at current regulations that are being pushed through, including GDPR in Europe and the California Data Protection and Privacy Act, and the 21st Century Cures Act, all of these new regulations are really pushing for individual data privacy and agency. So there's a lot of reason that this is a timely opportunity for us. And so this can benefit physicians, give us autonomy, freedom of mobility, but especially health systems and insurance companies would also benefit from this because they don't want all of that time, waste, and friction. They want to be able to quickly onboard physicians, and so that would help them as well. And of course, patients, you know, will now no longer be worried that their data and their information is being used by entities that might not have their best interests at heart. And, you know, I want people to consider the possibility that when you are employed, you now have to both serve your employer and keep them happy, but also serve your patients and keep them happy. And there is at times this sense of a conflict of interest with the Hippocratic Oath and with the employment process. And so this is why Benjamin Rush Institute is so important to me as an organization, because it's trying to help you know, expose that to you at an early stage. And I didn't really understand it until I practiced for 10 years, but that's a very real thing that we need to consider, especially when hospitals are forcing us to document our patients' protected health information onto centralized electronic health record systems that they then take, sell, analyze the data in order to try to find ways to deny services to patients and to deny payments to the physicians. So I think that we need to start considering that as employment might be a conflict of interest with the physician-patient relationship, at least if we don't start making some rules about you know, how we engage in this way. And so this is the market opportunity, just to kind of give you an understanding. You know, technology is expensive, it costs money, so we needed to find a sustainable business model to allow this to run. And so, you know, the cost of credentialing is about $5 billion annually, and so that's going to be our first use case. Every 2 years, a physician needs to re-credential for insurance companies or for health systems. And so if we streamline this, if we allow the doctor to be the one who owns and controls their credentials, and then as an individual sells access to those credentials, and puts time limits on it and is able to watch and understand who's using their credentials at any given time, not only would identity theft, like what happened to me, be prevented, But the physician's going to be rewarded and paid for that credential that they do own, because they're the ones that went through medical school and residency and all the hard work to get it. But there's also all these other potential market opportunities. You know, for example, 3 gentlemen you might know of, Jeff Bezos, Jamie Dimon, Warren Buffett, you know, they just got together and said that they're going to fix healthcare. Well, between the 3 of them, they cover 1.1 million lives. That's how many employees they have in their companies combined. So they spend about $15 billion a year on healthcare coverage. That doesn't include deductibles or co-pays. So imagine if a percentage of that went directly to the physicians on a network where they knew exactly who they were, they knew they were credentialed, they were able to get inferences from the data that they might be able to share. And considering that of every healthcare dollar, 30% is currently wasted on administration, I think that those 3 gentlemen would want to see that administrative cost reduced. And I think that a technology like this could probably reduce it to 2 to 5%. And so these are the competitors that I mentioned before. You know, HPEC is the only completely self-sovereign, physician-owned, physician-controlled platform that also includes communication. Now, these other platforms are also doing credential exchange. I want to point out the Synaptic Alliance, which is the 4th one down on the left. So that's a consortium of insurance companies. It's United Healthcare, Aetna, Humana, MultiPlan. And what they're doing is they're scraping all of our information, all of our personal and professional data as physicians, and they've built a blockchain to trade it amongst each other. Now, why are they doing this? Why are these companies that traditionally have been in competition working on a solution together? It's because our data as physicians is extremely valuable to them, and because they're going to be penalized if they don't keep these records up to date. But all of these entities have a critical dependence on you as an individual physician giving away all of your professional data in order for their systems to work. So I'm giving you an opportunity for you to own that yourself and to not have to give it away to these entities anymore. And so how does it work? And I apologize for this slide, it's a little busy. But essentially, as a physician, you already own your credentials, your medical license, your residency certificate, your medical degree. You take a picture, you upload it, now you have your credentials stored on your digital wallet. Now, they're not verified. You know, anybody can forge a document, but this allows you to start the process of identity verification. And you invite physician colleagues who know you, people who graduated with you, people who went to residency with you. And so just like on LinkedIn, where you kind of have people who endorse your skills and services, you invite people to endorse that you actually graduated from medical school, you actually went to residency, you actually are licensed and practicing in the state of New York. And the more people who you invite, the more robust your identity becomes. And so as you invite people to the network, they get rewarded with HPEC points for coming on. Now, once we have a network effect, once we have a critical mass of physician users, then we can go to the licensing bodies and say, hey, will you just confirm that this is true? And so, you know, it'll be something that's easy for them. We're going to have a very slick UX and a slick UI that's going to help, you know, alleviate all of the paperwork nonsense that they have had to do in the past. So, you know, I think that we have a very good chance of making this a reality, but again, we need the network effect. Now, I want to explain to you how we're going to generate revenue on the platform and how we're going to keep this platform running with the physician community empowered to do their work and to own their data on the system. So there's the patients and the payers. Patients will have their own self-sovereign identity. We are not building that for them. There's many, many, many people that are working on these technologies, and we want to essentially potentially partner with them as long as they're truly self-sovereign and giving the patient complete agency and autonomy. Now, the physician side, that's the side that we're building. And so just like you do now, you take care of patients and they pay you. Whether they pay you with cash or whether they pay you through their insurance, that's completely up to the doctor. You choose as a physician how you want to get paid and what you want to be paid. And you can get paid at the time of service on this platform. And so it might be JP Morgan Chase that's paying you directly if they choose to use this platform in the future, if they see that it's saving them money, which I think that they will once we build it. And so there's only going to be a 2% transactional fee. So all of the money goes into the physician's wallet. 2% of that transaction, a little bit about the same as a credit card transaction, gets taken, and half of that has to go to the investors, because we need investors to believe in this technology early to help us build it. But then the other half of that gets given back to the physician community. So essentially, half of all revenue is going to go into a pool of funds. So now what do we do with those HPEC points? As physicians, we can use those HPEC points to essentially purchase services that the community provides with that money. So what am I talking about here? We could use it for publications, consumer reports of all things healthcare that we can push out every quarter. Each specialty could do it. When you have your identity, you can tag your professional information to that identity. So for example, every single direct primary care doctor in the state of Nevada could be on one essentially Facebook-like chat group where they can communicate, collaborate, and convene, and then put their points to real use by voting on how to spend this money. Do they want to put it towards lobbying efforts? Do they want to put it towards incubating a new idea? If a surgeon has a new device that they came up with, they no longer will have to give away the intellectual property to their employer. And so I think that there's a lot of things that we could do with a system like this, and I'm really excited about it. And so, we're a very early company. We're a startup. We are in the process of building our MVP. We raised a small friends and family round from physician-only investors. This is a 100% physician-owned company at this time. And as we build the MVP, we're going to look for user feedback. So I would love for you all to be a part of this so that you can help us build it and design it in a way that's for you, because you are the future as medical students especially. And so your feedback would be really valuable to us. And so we eventually, you aim to use the MVP to essentially design version 1, continue to build the community, and we really hope to essentially become the decentralized, digital physicians guild, disintermediating the AMA, disintermediating Kaiser health systems and things of that nature. And so this is our fundraising request. So I've gone through a lot of effort to make sure that every physician, regardless of their position, regardless of whether they're medical students in training still, regardless of their financial situation, would be able to buy in and become a partial owner in this. And the reason I've spent so much energy doing that is because in the effort of true decentralization, the users of a platform need to also be the owners. So I'm giving you an opportunity to become an owner. The minimum is a $250 buy-in, and that will be available on the Fundopolis website. And this is the level that I would hope most medical students choose to come in at. $500 is for residents, but I have had some residents that have already invested $5,000 because they see the power and the value of this. So, this is not a GoFundMe campaign where you're donating money. You are purchasing stock and becoming a partial owner in this company that's already completely physician owned and run. So I hope that I explained it all. I see that there are some questions. I'm happy to answer questions, and thank you for listening. Please take my email down if you ever want to reach out.
Are you able to see the questions?
I need to stop the share first. I think I saw.
Sure.
Okay, so there's 7 here. Okay, so all set. Few questions.
Yeah. So if you look on the Q&A.
Oh, I see them. Okay.
Okay. So the open ones, Chris Garofalo.
Okay. So when you use your own self-sovereign identity to log into the internet, I understand that anything that I create is private, but how do we maintain control when we interact with other groups like Facebook? So Facebook will always be centralized. It's really interesting. Jack Dorsey of Twitter recently put out a tweet a couple of months ago saying that they're going to try to create a decentralized Twitter. Now, why does he want to do this? I think a lot of it has to do with those regulations that are really pushing for privacy and agency. And so the more regulations that people are putting out, the more grief and strife that Facebook and Twitter have, because they're kind of in control of people's thoughts and actions, and they're not supposed to be in control of that according to these new regulations, and they don't want to be in control of it anymore. So I don't know what Mark Zuckerberg's take is on that, but I know that Jack Dorsey's thought about it, and they are also, he in particular is also starting to think in a more decentralized, self-sovereign, individualized control of data. But there's no way of knowing, and this is why I think we need to build this technology, so that unless these systems start giving us privacy and agency and autonomy, we can now have this system that we've built for ourselves that gives us that instead. So that's part of why I'm doing that. So when you send information to a hospital credentialing body, how does that stay private? Don't they need to share it with others? So this is a really beautiful question. And so in order for the system to work, we need a critical mass of physicians to jump on board and to agree that this is the way that they're going to share their credentials, because this is the only way to keep it private and owned by you. Now, in order to do that, hospitals, health systems, insurance companies are going to also have to have enterprise level self-sovereign identities. So that will track when they are using our data. So blockchain, so this technology is based on blockchain technology, on distributed ledger technology. And blockchain in and of itself is perfect for tracking who is using and accessing things. It's a supply chain technology first. So we are the supply chain of physician talent, we as physicians. We are the supply chain of services that keep humanity alive and well. And so when they're using that supply chain of physicians, we're going to be able to see when they're using it. That's part of what's built inherent in this technology. And same individual, how do we, so what I'm not understanding is how we then interact with others. How do we make our hospitals accept our HPEC credential? How do we get insurance companies to accept our credentials? Well, first of all, if you remember, all of the currently available technology, including CAQH, they require us to give away all of our data for free. Now, who built these platforms? Private entities. So a private entity created CAQH. Yes, it's a nonprofit, but when we think about nonprofits and the millions of dollars that flow through them and where that money goes, you can imagine that it's a valuable thing for them to have. So we have an opportunity to build the new system today. Yes, if only 28 doctors decide to use this, then it will not be valuable. But if we are able to reach a critical mass, if everybody buys into the platform, becomes partial owner, shares it with each other, we can have a network effect and make this community grow. And I want to be very clear, the people here on this webinar right now who are listening, I call us activated physicians and physicians in training. We care enough to learn about the new opportunities in order to make a change in the world. And so even though there's 800,000 to 1 million physicians that are in the country, the activated physicians, the ones who are participating in this webinar, are also the ones that can really make a change in the world. But we just need to choose to, and we need to step forward and do it. And so the link to invest is not up yet, but if you take my email down, Leah, L-E-A-H, at hpec.io, and also if you go to our website, hpec.io, and sign up for our newsletter, you will be informed when that happens. And then, yes, anybody can invest, actually. Crowdfunding campaign cannot discriminate, but I really am hoping that physicians more than anything decide to come on, and I'm really trying to do outreach primarily to physicians only. But if we have a value-aligned investor who wants to come on board because they want to see the physician community empowered, why would I say no to that? So how do you collect money from insurance companies? Yeah, so another question that really is only answered once we have a network effect. Insurance companies have been denying payments to physicians and delaying payments and increasing prior authorizations and what they call surprise bills, which shouldn't be a surprise because the service has already been rendered. So in my opinion, that's more of a theft of services by the insurance company, because insurance means that you are insured, that you will be covered. And unfortunately, they're not providing that insurance to patients. So in my opinion, what's going to happen is there's going to be a mass exodus of the physician community from these insurance networks that do not pay them for their services. And when that happens, if they want to come back, then we are going to have to decide whether or not we're going to put them in our networks rather than them putting us in their networks. The power is going to be switched. That's what the whole point of this. That's why my company name is the Humanitarian Physicians Empowerment Community. Have I been able to connect with some of the .com startup generations such as Bezos? So yeah, I actually talked to a high-level executive at Amazon about a year and a half ago, and they loved the idea and they were thinking about it, but we were too early, and we're still too early. Remember, we haven't built this yet. We're a startup. So I do imagine that these entities are going to get very excited about it once they see that the physician community is excited about it. And so one from another question, do I expect any pushback from hospital systems when physicians try to use blockchain for credentialing? Well, if you looked at the competition analysis, there are lots of hospitals that are already using some of those systems. ZAQH, Synaptic Alliance, ProCredX, Axual, they're all working with hospitals already. So health systems already kind of understand this technology. Do I think that they're going to have some pushback with the individual physician being ownership in, have the ownership and control? Yes, but I don't care. That's not my problem. I think that the hospitals that do not want to empower the physicians that serve their communities are hospitals that are not serving our patients, and they are hospitals that should be probably shut down and reappropriated and owned by somebody who does care about the physician-patient relationship and who does put physicians and patients first. So yes, it's not going to be easy. And yeah, I'm kind of a renegade when it comes to this, but I think that it's time. I think seeing how abused physicians have been, especially during this coronavirus pandemic, it's a timely opportunity for us. And so
there is one more from the chat. It's from Marlene. It says, what is going on with the big insurance companies and others that were working on blockchain credentialing?
Well, so I think you might, so there's a couple of, let me just show you the competitive analysis page again, if I can. Let me share my screen once more so that you can look at who we're talking about here. Put this down. So this is the Synaptic Alliance. That's a consortium of insurance companies. This is the Professional Credentials Exchange. That's a consortium of blockchain credentialing platforms that are being adopted by hospitals and health systems. Axual is also using a very similar self-sovereign identity technology, but they're going to health systems first. And a lot of the reason that these entities are going to health systems first is because physicians didn't seem like they were interested. They didn't want to have to deal with going to individual doctors and trying to get us all on board. I'm taking that challenge because I believe in us as a community. I believe that we have the power, the drive, and the motivation to restore autonomy and agency to the doctor-patient relationship. So yes, these entities are all putting our credentials on blockchain. They're trading them amongst each other, and they're getting all of the value and the benefit from that. And they're all very early projects. So these are projects that really were only born over the past few years. So we still have a real opportunity to build something ourselves and to keep the value for the physician community directly. And then, allow the physician community to take that value and vote on how to spend it. Was that the last one?
No, one more. For now, I see, how about using your current system to bringing in cash paying patients to the members?
Right. So if you look at the actual numbers and the actual trend in how people are paying for healthcare, there's been a trend in increasing cash payments. This is partially because there's a lot of people in the gig economy who don't have employers covering their healthcare. Even employers are starting to purchase policies that have very high deductibles. So sometimes you have to spend $2,000, $3,000, $4,000, $5,000, $6,000 a year just to meet your deductible before you're even able to use your insurance. So I do think that there's a general trend in paying more for cash, patients paying cash more often. I do want to acknowledge that it's really important for us as a physician community to take care of patients who aren't able to pay, who are socioeconomically disadvantaged. But especially the DPC model, many of my direct primary care colleagues and friends, a lot of their patients are Medicaid patients who are choosing to pay cash because they see the service is better when they pay their doctor directly. The direct primary care prices are often very reasonable. And to have that personalized service is something that, in my opinion, is, it's invaluable. You can't put a price tag on it. So, we as a physician community need to decide what we want our future to look like. Do we want to be in control? Do we want to be allowed to choose whether or not we're going to give somebody a discount because they're socioeconomically disadvantaged, or because we want to give a certain percentage of our time back to our communities? And I think this type of technology will also allow us to do that, and it will allow us to reward physicians on the network. We can reward each other with a technology like this too, and support each other when we're going through, economic difficulties. Blockchain has an ability to insulate against economic collapse. That is one of the powers of this technology, and that's why so many people got so excited about Bitcoin and Ethereum, because that's one of its powers.
I really like this next question, and leading off with what he says, this is a great idea and I love it. Physicians have been traditionally difficult to move in one direction, i.e. herding cats. This will involve sometimes medical students too. This will involve significant herding. How do you think this can be accomplished?
So you are absolutely correct. We as physicians are an extremely smart, analytical bunch of people, way more so than almost any other field. And especially considering from a very early point, we start kind of focusing our energy towards subspecialties and specialties. So even like second year of medical school, we're thinking, oh, we're going to be an orthopedic surgeon, I'm going to be an emergency doctor. And so we start building these little tribes, and we start really becoming attached to our identity when it comes to what field we're being credentialed for. And there's a lot of infighting. However, I do also think that we have finally realized that behavior is no longer serving us. And so sometimes certain behaviors serve us for a period of time, and then we need to recognize that they're no longer serving us and let go of those behaviors. And I think now is a time, watching how health systems and group purchasing organizations have not provided the protective equipment that physicians need to keep safe and to keep their patients safe. We're now realizing that this medical industrial complex system is not serving us. And we collectively as a community need to come together. And I've heard this cat herding comment probably over 100 times since I've worked on this. And, one of the first physicians who I reached out to about this, who's now an investor, he said, I don't know. He's like, I'll invest, but it's going to be pretty hard. Getting doctors together is like herding cats. And I reached out to him recently, and he said, looks like you've become a cat herder. And, it's not easy, but I want you to understand, I've dedicated my life to this because I dedicated my life to the practice of medicine. And I feel a direct conflict of interest with the current system and the Hippocratic Oath that I took. And I feel that genuinely feel like this tool is the answer that the physician community is looking for. And if this isn't the answer, I don't know what is. You know, HPEC is part of a coalition of over 70,000 physicians and 3 million physician or patient advocates called the Free to Care Coalition. We actually recently put out a petition. I asked you all to think about looking it up and signing it.
And I am happy to send that to you because Benjamin Rush Institute just recently joined the coalition. So
Yeah.
I'm happy to send that to anybody who needs it.
So I guess my point, thank you very much. It's great to hear. It's a very, very important movement. It's bringing people together. And so I guess my point is that, 70,000 physicians is a lot. And we're already connected to that group of physicians. So I do think it's going to be difficult, but it's a challenge I'm willing to take. And with your help, we can do it together.
I'm so excited about how you framed that, because, it's the passion behind that and that change that makes our organizations, your company and our organization, keep surviving and thriving. I think it's the backbone of what we all have to do, because we're pushing forward in a community that's making exemplary changes. And I think that's what we all have to do. I love this question. And I love it more because my CEO is on this call. And as a CEO, what keeps you up at night?
Well, there's not enough hours in the day. I have been extremely fortunate to have really, really passionate, very smart, very dedicated people come on board to this project with me. But there's still not enough hours in the day. And, every time I come across a physician who says, "Oh, I've never heard about this," I'm excited that I've gotten a chance to share it with them, but it stresses me out that there's not a way to get it out to them faster. I see, Dr. Pamela Weibel has been talking about the physician suicide problem for quite some time. Physicians are killing themselves because they would rather die than continue to participate in this disempowering system that exploits them and their patients. I think that this is one major big puzzle piece, one big tool that can alleviate a lot of this stress and fix this problem. And so it keeps me up at night when I feel like I'm worried that people aren't going to get the message, because it is a very complex technology. This is a new idea. It's kind of like talking to somebody who's trying to fix their wagon wheel on a horse and buggy about how Uber works. First you have to explain electricity and cars and telephones, and it's lots of steps, but it's a real and present opportunity. And so that's what keeps me up at night, worrying that I'm not going to get it out there. So I appreciate you for allowing me to share it in this way.
Well, we definitely thank you for joining us. I put your email address onto for all attendees, and I will do the same for our friends on Facebook. Thank you all for joining us. This video will be available. So if you would like a copy, I put my email address below, and I'm going to put our website. So our contact information will be there. So if you would like a copy to share, we did get that question. So if people that would like a copy of this, and if you know people that would like the opportunity to present to our medical students, but also our network, we are desperately trying to get as much information out to the public about different alternatives in free market healthcare. We have this wonderful coalition that we're now part of, which we're very excited about. It's amazing the amount of information that is being spread and the advocacy work that is being done. So if you have information that you'd like to get out to the world, please send me an email. We have this great team, and we'd love to get the information out. So thank you so very much for your time today. And please get in contact with Dr. Houston and let's continue the good work. Thank you so very much.
Thank you for the opportunity, and thank you for listening, everyone.
Have a great day, guys.